When it comes to discussing, the cost of dental implants, it's very difficult to give you a specific number because every patient is unique and every patient in every situation is different. Some patients come in with a missing tooth that's been gone for years, but they still have a lot of bone there. So we can literally go ahead and put that implant in the same day and then a few months later put the crown on it. Some patients have a lot of bone missing, and we need to build up that bone before we put the implant back in there and before we can put a crown on there. Some patients in the upper and the posterior part of their mouth might have sinus expansion, so we might have to graft or lift the sinus and do what's called the sinus graft. So every case is unique, everybody's different. Some patients have osteoporosis, so their bone is a little bit weaker. Some have really strong bone that hangs around for a long time. So you can't just give a price, or you can't just quote a price to the patient over the phone. You really need to see that patient one-on-one. You need to do a 3D x-ray, a cone beam CT, which we have here in the office, and then we can give you a proper breakdown of exactly what it's going to cost with no hidden fees or anything, and you'll know from the beginning exactly what is going to cost you, if insurance covers any of that, or what's going to be out of pocket. But you'll know that from the beginning, and then we can take it from there. In our office here, we go through a lot of continuing education to provide the highest level of service, and when it comes to these types of large implant procedures. We do provide sedation for the patient, so everything is done while the patient's asleep, and everything is very comfortable for the patient. They really don't remember the procedure at all. They just wake up with a new smile and very limited or minimal post-op pain or discomfort. And we have multiple financing options for the patient to make this affordable to them and allow them to pay this off over time, so it's not really traumatic for their budget or anything like that, so that they can get the procedures that they want to have done and be able to pay it off in a timely manner that is comfortable to them, and they don't have to worry about that part of these types of procedures.